We began our Africa series in Nigeria with the help of our filmmaker Ifeanyi.
I'm Ifeanyi. Welcome to Healthcare Planet, Nigeria.
Nigeria is special to me because my medical mission trip there years ago inspired me to create Healthcare Planet. With 176 million people, Nigeria is the 7th largest country in the world. With an estimated 34,000 healthcare providers and hospitals, they have a serious shortage to meet the medical needs of their people, resulting in the median age of only 18 and the life expectancy at 54. Compare that to the global average of 70. This episode will explore why these statistics are so low and offer possible solutions to help improve conditions. One possible solution is telemedicine. We are already in discussions with the University of California, Davis on the possibility of implementing a program in Nigeria. In the 1800s, Nigeria began building a Western medical system in addition to the traditional model of herbalist medicine, which you see here, as herbs are prepared to package and sell in the open markets. Regulated by the federal, state, and local governments, we will explore Nigeria's universal health insurance for all citizens, and we'll examine many organizations such as the Medical Association. The big cities have built advanced large medical schools and hospitals, staffed with trained medical personnel and managed by educated healthcare executives. We'll see the various types of healthcare based on the economic classes, the rich, the middle class, and the poor. It is particularly challenged for the disabled here. We have some interesting conversations with physicians. We tour various facilities and talk with the locals. Healthcare in Nigeria is financed through tax revenue, cash patient payments, international donor funding, and health insurance. Households continue to be the major source of health financing in Nigeria. They're out-of-pocket spending. Nigeria has made great progress with resource investments in medical equipment, technology, and supplies, as well as medications needed to better diagnose and treat patients in order to improve their outcomes. The World Health Organization ranks Nigeria as 187th out of 191 countries. They have a lot to improve, and everyone we talked with are highly motivated to make this happen. The inadequacy of the public health system in Nigeria has given increasing prominence to the private health sector, both profit and nonprofit, which reflects about 60% of their total healthcare system. As we venture away from the big cities into the rural villages, we see a different picture. Nigeria generates about $500 billion in gross domestic product. However, 70% of the population live in poverty. It can be especially challenged to deliver the necessary medical services to the people who live in small villages. They lack properly equipped sterile medical clinics, services, supplies, and personnel. You can see how different this is compared to larger cities that are better funded. We used to have this challenge throughout the United States until our government developed funding programs to support most of America's rural areas. We discovered there are many physicians, organizations, and individuals going to Nigeria and helping them to improve their healthcare system. Some of the accomplishments they are achieving are providing additional medical services, building mobile clinics, and creating more emergency services. We have a lot more to show you in much greater depth about the healthcare arena in Nigeria. So please join us on our upcoming full episode of Healthcare Planet Nigeria.